Good morning and welcome to today's OHS Insider webinar. Our topic today is building an effective ergonomics program in a COVID climate. We have Rachel Mitchell from Ergo Consulting as our speaker today. Rachel is the manager of ergonomics services with Ergo Inc., a national ergonomics consulting and training organization. Rachel is a Canadian certified professional ergonomist and a registered kinesiologist with over 16 years of experience. She holds a Master's of Science in Human Factors Engineering from Nottingham University and has over 15 years of ergonomics consulting experience in a range of industries ranging from manufacturing, corporate services to healthcare. She is also the president of the Canadian College for the Certification of Professional Ergonomists. Rachel builds relationships with employers, workers, and unions to ensure successful ergonomic and injury management outcomes, whether it be injury risk reduction, workstation and workflow design, ergonomics program development, or return to work planning. Rachel's webinars always prove to be incredibly popular with our audience, and I'm sure this one is no exception. As you can see, we're really lucky to have Rachel here with us today. I will be your moderator, Samantha. And before we get the formal presentation, I'm just going to run through a quick housekeeping notes. We will be answering all questions at the end of the presentation. However, please feel free to submit them as you think of them. To submit a question, click the orange arrow to expand the GoToWebinar control panel. Click the question drop-down bar, type in your question and hit enter. You can also use this to let me know if you're having any trouble watching and listening to the webinar. I do recommend if you have an audio issues or any kind of issues, just log off and then log back on. That generally fixes stuff, but just in case, give me a note. If for any reason you lose connection altogether, please give us a call on 1-800-667-9300 and one of our customer service representatives will be happy to help you get back online. And as usual, for any additional resources following today's presentation, I'll be sending them around via email, a copy of the slides, a copy of the recording, and also today we have additional newsletter from Rachel and Ergo Consulting. Please do expect a call from one of our representatives later today to make sure you receive the following information. And without further ado, I'm going to pass you over to the main event, pass you over to Rachel.
All right, thank you very much. Are we okay, Sam? Everything's up?
Yep, everything's up, thank you.
Okay, perfect. Well, thank you everybody for joining us today. What I want to spend some time talking about today is how we go about building an ergonomics program. And I want to take sort of a COVID perspective on this. So the things that perhaps we've had to modify or additional things we need to take into consideration related to our ergonomics program planning as we move forward in the current climate. So as Sam mentioned, I work for Ergo Inc., which is an ergonomics consulting company based in Southwestern Ontario. The company's been in business for 25 years. I've been in practice now 18 years, all in the consulting field. And so I will kind of make a note that there are some references that I will make today that are sort of Ontario based. That's simply because that's the area that I work in, but these will apply, you know, across the country as well. So what I want to do is talk about kind of what the primary goals should be for an ergonomics program. And then we're going to use as our reference for today the MSD prevention guidelines. These, again, were developed specifically in the province of Ontario, but they are being adopted across various provinces. They are even being adopted outside of the country as kind of some best practices. And so our 10 steps that we're going to be looking at to look at how we put together an ergonomics program, those 10 steps are taken from these MSD prevention guidelines, and I've got the website up there for you if you'd like to take a look at it. As we go through the steps, I'm also going to give you sort of as reference from our discussions with our clients, you know, what are the things that are in an ergonomics program that the Ministry of Labor potentially is going to look for if they're doing an inspection of your workplace? What are the things related to ergonomics programs that they're specifically looking for or asking to see when they complete these visits? And then I'll try to point you at as many resources as I can as we move forward. So kind of in the context of where we are all today, I'm going to assume the majority of people in this call, may be working from home offices, and that presents all sorts of challenges in terms of how we roll out home office ergonomics programs. We know we've got employees and staff who are working with decreased capacity. And so that means two things, both a decrease in their physical capacity. We know that with the closure of gyms and decreased recreational activities, that people may not be in as good physical condition as they might have been prior to COVID. And we've also got people operating at a decreased mental capacity. So people have so many more stressors, so much more anxiety. People are juggling additional responsibilities, taking care of, elderly family members. Maybe they have children at home at the same time that they're trying to complete their jobs. So there's really this increase in kind of mental demands being placed on our employees. And there may be people who actually have larger workloads. So some companies, as a result of COVID, have had to decrease their staff, have had either permanent or temporary, maybe sort of more workload on each individual person's plate. There may be additional protocols that now have to be done as part of the COVID, additional cleaning processes, all adding to kind of how much somebody needs to get done in a day. We've got employees who potentially were off work for extended periods of time and then have to return to work. So very much some of those challenges that we face when we do return to work with employees who've been injured, we almost have that same process with some of our regular employees. And kind of front and foremost is that a lot of the ergonomics programs are now operating with decreased funding because funds are tight, profit margins are tighter, and all of those kinds of things kind of associated with the current climate. So these are the things that we're going to be taking into account as we look at this sort of 10-step process to put together an ergonomics program. So the first thing that I want to touch base with is just sort of legally what is required in terms of an ergonomics program. Now, again, I've got a picture here of the Ontario Occupational Health and Safety Act. This is no different though across provinces, and that is that we are required to have sort of these ergonomics programs simply under the general duty clause. So the general duty clause indicates that employers have a responsibility to protect the health and safety of employees. And that health and safety sort of catch-all is what ergonomics falls under. So there are no ergonomics, regulated guidelines in the provinces. We generally operate under these general duty clause. There are some additional in BC, additional sort of guidelines, but again, most things fall under the general duty clause. So the goal of an ergonomics program is simply to address ergonomic hazards effectively in a way that is no different than how you handle all other occupational health and safety hazards. So if there is a hazard in the workplace, whether it is a tripping hazard or an ergonomics hazard, we have a responsibility to identify it and then to do what is within our power to protect the workers and reduce the risk of injury. We hope that if we have a good ergonomics program in place, that we will then also get improved productivity with our employees, improved quality, because obviously if people are uncomfortable in their workstations, if they're struggling with their jobs, productivity and quality tend to suffer. And so because there are not specific guidelines related to ergonomics in the Occupational Health and Safety Act, within Ontario, the MSD prevention guidelines has become sort of the gold standard or best practice of what an ergonomics program should look like. Now, this MSD prevention guideline launched in the fall of 2018. Now, if it sounds familiar to you, kind of predating 2018, it did exist in a paper format prior to 2018. I want to say it goes back to 2008 or 2010, but it's quite a number of years old. But it was sort of revisited and recreated as an online platform. Within this website is basically anything you can imagine you would ever want to find with respect to MSD prevention, ergonomics programs, checklists, tools. So it is a great place to explore and kind of see what's see what's out there. But what we're going to be talking today is specifically about the guidelines for program development. So there are 3 guidelines within the system: a quick start program, a basic program, and a comprehensive program. We're going to be having our discussion sort of around the basic guideline. That is a guideline that was developed for medium to large sized companies that already have an existing health and safety program. So it's looking more at how we slide an ergonomics program into a program that already exists, obviously not having to then recreate the wheel and something from scratch. So it does this in 10 steps, and I'll show you sort of the resources as we go through it. So what I'd like you to think about is sort of the ergonomics program that maybe you have at your facility. Is it a successful program? And if it is a successful program, what are the things that have made it successful? Hopefully those are the things that we're going to be touching on and highlighting as we go forward today. So the very first thing that needs to be in place for a program to be successful is that there has to be some sort of management, commitment, and leadership to an ergonomics program. So what does that really mean? What it means is there has to be a commitment to some kind of resources, right? So resources means there has to be funding for an ergonomics program, but there also has to be resources in terms of staffing. So you have to have employees who have some knowledge in this area. You have to have employees who are given the time away from potential other job roles to participate in an ergonomics program. Because if everyone is too busy with their own job roles and this is not a priority in terms of people spending time on an ergonomics program or an MSD prevention program, then obviously that program is not going to go anywhere. There needs to be some leadership for the program, and that leadership has to come from all levels. So it means the highest level executives are on board with an ergonomics program and are showing some leadership, the managers, the supervisors, all the way down to the employees. There should also be, as part of this commitment, some sort of ergonomics or MSD prevention policy. Now, you do not need a standalone ergonomics policy. You can simply roll this into an existing occupational health and safety policy. So you can decide what is the easiest way for you to handle this, whether it's 2 separate policies or whether you roll the 2 things in together. But that policy really is outlining that commitment to prevention, what the procedures are for that ergonomics program, how people request assessments, kind of what happens, how things get done, who is responsible for what, so on and so forth. The next thing we have to make sure is in place is that there are some responsibilities assigned. So oftentimes ergonomics is owned by a health and safety department, and we want to make sure that those responsibilities are not held simply within that department. So does the Joint Health and Safety Committee have some responsibility for ergonomics? Do you have some sort of ergonomics champion? Is there a management rep on an ergonomics team? If you have an ergonomics team, again, to kind of show that commitment to the program at all levels. And then in the current climate, what we really need to think about is how we allocate our resources. So what I'm finding with a lot of clients is that we are reprioritizing our projects for the year. Things we thought we would do in 2020, we no longer have the funds to do. And so the focus is, how do we improve people's working situations? How do we reduce risk with that low-hanging fruit, with those low-cost, easy solutions, so that we're having an impact, but we are not spending kind of that larger capital, and that some of those projects are being pushed into 2021 and even kind of 2022 at this point in time. Now, one of the things that we know sometimes is asked is, if a Ministry of Labor inspector is coming and taking a look at your program, they will ask to see your occupational health and safety policy, and they are looking for some reference to musculoskeletal disorder prevention, MSD prevention, or ergonomics in your policy. So they're looking to see that there is a written document about how MSD prevention is handled at your site. Now, the other thing kind of to mention with respect to this policy is just sort of some some points about what goes in those policies. So those policies should outline what everyone's roles and responsibilities are. So what is the responsibility of employees within your MSD prevention program? What is the responsibility of managers? What's the responsibility of supervisors? What is the responsibility of the owners or highest level executives? And it should outline the process. So how do people raise concerns? How do people request assessments? And now an additional kind of policy piece we all need to think about is how do people request assessments for home offices? How do people assess, how do people request the ability to take home their office furniture if their office furniture is still sitting in an office and they are still at home? Or how do we allow people to purchase furniture? Is that done with a stipend? Are people submitting their receipts? Are we ordering furniture for people? And so those things may need to be added to your policy at this point in time, or sort of appended as a kind of home office policy in terms of how those pieces are being handled in the current situation. The piece really to keep in mind here is that MSD prevention should be integrated into your existing management system. So the Ministry of Labor is generally looking for a comprehensive internal responsibility system. So you can look at this sort of MSD prevention or ergonomics programs as being part of that, plan, do, check, act cycle. The same thing you're using for health and safety, you're using for your ergonomics. So don't think of those two things as being separate entities, but rather kind of part and parcel of the same thing. It is generally easier to just sort of expand the definition of injury prevention to include MSDs rather than kind of handling ergonomics as a separate piece. It also allows us to put more importance on it than if we sort of handle it as a separate and side entity that can easily be sort of forgotten or not prioritized in a time where we are kind of tighter with resources. So I want to show you sort of a few case studies as we go, ways in which we can really demonstrate that commitment to ergonomics in this case. So one of the ways we can do that is by embedding ergonomics in other departments and in other processes outside of health and safety. So the best way to do this, and the best example, is embedding ergonomics in the purchasing process. So even pre-COVID, there are facilities where when people's chairs wore out, they just sort of pulled out the Staples catalog and people ordered their own chairs. And if we allow people to do that now in a home office situation, now the realm of what petite people are potentially going to order and end up within their homes becomes a little bit more open and potentially a little bit more nuts. And so what some facilities do is they sort of lock down that purchasing. They have a gatekeeper in the purchasing department who has some background and knowledge in ergonomics and also knows who to go to when they need more help. And I have seen facilities very successfully set kind of limitations on what can be ordered. So perhaps there are 3 different styles of chairs. They come in kind of different sizes for different people. You can only order what is there unless you go through somebody on an ergonomics team to specifically request something else. And then we ensure that people are ending up with a good quality product, something that is going to work well and something that is going to last more than six months. Some of the inexpensive Staples chairs are notorious for falling apart fairly quickly. The other way is to embed ergonomics by ensuring that a joint health and safety committee or an ergonomics committee has people from a lot of different departments. So having somebody who's an engineer on this team, having somebody who's in maintenance, because nobody's better at MacGyvering new ideas and solutions than a maintenance department, making sure maybe even someone from purchasing are on those teams will help to make that responsibility for ergonomics kind of spread wider and get more people involved in that process. So in keeping with that sort of idea, the next thing we need to look at is making sure that we are facilitating and encouraging employee participation in an ergonomics program. So how do we do that? The first is making sure people have the knowledge and the education in order to be able to help themselves. So employees need to be trained to recognize the hazards that are present. So whether that is someone in an industrial setting who needs some training on the use of hoists and avoiding manual lifting, whether it is somebody in a home office who has no idea how to set up a home office and hasn't been provided with any information. So making sure that people have the information they need in order to to help themselves position themselves better. We want to make sure that we are setting up systems where people are encouraged to report injuries and discomfort. And I've highlighted this because I think, there are always situations where, there can be incentives. We have facilities where at the end of the year, everyone gets a leather jacket if we haven't reported injuries. And then who's going to be the person who on December 10th reports an injury and is then responsible for nobody getting a leather jacket? I think also with the home offices right now, people feel like it's not the right time to raise issues and raise concerns, or they feel like it's sort of outside their control because they're in a home office. And so I think the encouragement of speaking up when you're having difficulty and asking for help is something that is really sort of problematic right now. We can also involve employees by having suggestion boxes, getting them involved with developing solutions. If you're in an industrial setting, having them participate in trials of new equipment, new methodology for their work. You do not need to have an ergonomics team, but if you don't have an ergonomics team, your Joint Health and Safety Committee should be responsible for ergonomics, which means that when they do their monthly inspections, the Joint Health and Safety Committee is also looking for musculoskeletal disorder hazards. So they're looking for those ergonomic hazards, the heavy lifting, the awkward body postures. They're doing that on top of the health and safety inspections. If they're not, then you need to either add those things into their checklists, or you need to have an ergonomics team who is responsible for that as a kind of a secondary piece. And then kind of, I think some of the barriers to this participation is, with remote work now, the team is not together. And so, ergonomics may get placed on a back burner at this point in time. I think that we have all been interpreting home offices as being a sort of quote unquote temporary situation, but 7 months in, this is no longer temporary. There are some people who are really suffering at home with some really terrible workstation setups and pain and discomfort. And if we don't look after those folks, that when they do eventually return to work, we're going to have a higher incident rate of reporting of injuries, and that we are likely to start seeing sort of reporting of injuries even from people who are working from home at this point in time. And people are concerned about, their long-term employment. So I think sometimes, if there have been layoffs and things like that, there may be a fear of reporting discomfort as well. So one of the things kind of in this case that we know is that when the Ministry of Labor does a visit, they will ask to look at Joint Health and Safety meeting minutes, and they are looking to see that ergonomics concerns are also being covered and are kind of part of the Joint Health and Safety Committee's inspections and meeting minutes if there is not a standalone ergonomics team, in which case they would ask to look at those meeting minutes. One of the other ways kind of that we can start looking at trying to get some better participation from those who are at home is providing employees with things like a webinar on how to set up their home office, or putting up a video or sending out a link to the YouTube video for, whatever your office chair is, if you've sent people home with their office chair, on how to set that up properly, sending people with some self-assessment checklists. There are some little office checklists in the MSD prevention guidelines that you could use to send out to folks, making sure that we're really encouraging a sense of team and collaboration so people know that they're in it together, and encouraging video calls so that there is that kind of regular face-to-face check-in to kind of help with that sort of sense of team and that sort of an encouragement to participate in the program. If you empower employees with the information that they need to improve their workstations, folks can get pretty creative these days in terms of how they set up their home offices. And I'd like to say that I think the ironing board is probably the real star of the home offices at this point in time, because it is, of course, the easiest height adjustable workstation surface that you can find in any home. So the next piece that we need to look at is, how we go about completing risk assessments and hazard identification. So this is really about kind of the process. So we need to think about, what is the process going to look like? So how do these assessments get done? Who is doing those assessments? And these should be documented in your policy. So this is both for folks who are at home and folks who are in the office. How are we going to do these things? Obviously, any of these hazard identification risk assessments should be done with folks who have some training. So you may be able to do some basic training for employees who can assist others, and then you might need to have somebody with a higher level of expertise to help people out who, after that first stage still are having some difficulties. When we're looking at where we start for doing assessments, you need to think about kind of what the sources of information you have available at your site are. So, reactively, it is generally people who are reporting concerns. It is places where we're seeing injuries, but proactively, it might just be checking with employees and asking them how they're doing. It might be a design review if you are updating a line or a process or equipment to try to predict where some of those issues may be when something new comes into place. It might be part of a pre-start review that ergonomics is kind of added into the health and safety piece. And we know that those are things the Ministry of Labor is looking at, that we are not being solely reactive in our ergonomics program, but that we are trying to be proactive in catching issues before they get implemented kind of into a regular process. So once we have that formalized process in place, then the assessments start to roll out. So, at the initial level, a hazard identification can be done in so many different ways. So it can be done through walkthroughs, it can be done through basic checklists. We've already talked about Joint Health and Safety Committee members or ergonomics team members doing inspections. So those are things that we want to see happening. And then you are going to need to have a procedure in place for a more in-depth risk assessment. So like everyone else, the field I work in has been highly affected by COVID. And so we now do virtual office assessments for folks who are working from home or we can't get into as easily to see them. So these things are all becoming kind of more common at this point in time. And then as we start to develop these lists of hazards, we're going to need to find a way to prioritize them. Now, just as kind of a background reminder for anyone who is sort of new to ergonomics, when we're looking at risk factors in ergonomics, we are really looking for three things. We are looking for tasks that have high forces. This is heavy lifting, pushing, pulling, gripping, anything with lots of elbow grease. We are looking for things that have high frequencies, so lots of repetition, and we're looking for awkward postures, bending and reaching and twisting and things like that. And generally speaking, jobs that have all three of those risk factors are more likely to create injury than a job that might only have one. Now, that is not always true. Something that is heavy enough can cause an injury if you handle it only once. But generally speaking, we're looking for those kind of combinations of risk factors. And now in conjunction, we have to keep in mind that we've got folks who may have decreased physical capacity on top of all of these other things from these leaves of absences that people may have had from physical jobs. So if you take a look at these pictures, if we think about the kinds of risk factors, that folks are doing, the person in the first picture who's order picking in a warehouse, there's some awkward posture. You can see there's sort of potentially some neck twisting that's happening behind that blue circle. There's reaching with the arms. There might be picking items up that are really low or that are up high. Some of these boxes may be heavy, so we may have both force and awkward postures. And obviously there's going to be repetition involved with a job like this. Someone who drives a forklift, what we tend to see are things like repetitive neck twisting, some repetitive back movement with a job like that. And then you can see in the third picture, this is somebody who is working from home. We have not only poor posture that results from non-ideal kind of office workstation setups, but we have to start thinking about the fact that we've got employees who are now also being exposed to psychosocial stressors. So psychosocial stressors have been shown to increase the risk both to mental health, but also increase the risk of both the onset and the aggravation of existing musculoskeletal disorders. So they are going to kind of speed up the process and the sort of onset of potential injury on top of the sort of mental toll that they take. And psychosocial risk factors are really about the the way that work is designed. So jobs that have a lot of unclear expectations or really high workloads, jobs where people feel they don't have a lot of control over the work that they're doing or are not highly engaged in their jobs, people who feel a lot of isolation, people where there's a lack of collaboration. And you can see that last point is going to be so much more sort of prominent now in this work from home COVID culture. These are the sorts of things that we're looking for as at presenting kind of some additional risk. So let's say we've gone through the process, we've identified where these risks exist in a job. There's sort of two ways forward. So sometimes we do an initial hazard screening that's pretty basic. We might just have the Joint Health and Safety Committee do an inspection. And as a result of that, it is clear where the root cause of the hazard is, and it's clear where the solution is. And at that point in time, generally, we just skip to implementing the fix. However, there are situations in which it is either not clear what the root cause of that hazard is, or potentially is a hazard that we feel we can't eliminate. So if we get into those situations where, or maybe it's a hazard that is just going to be very costly to eliminate, then it becomes more important to do a more in-depth risk assessment that allows us to kind of separate that gray area into a clearer black and white. It helps us to figure out whether there is the risk that exists is a need to fix or a nice to fix, so that we can better prioritize where those resources are going to go. And so if you're needing to do those more in-depth risk assessments to figure out exactly what needs to be fixed kind of now and what can wait, and exactly, you know, which solutions are going to do that for you, then you're looking to find somebody who's got a higher level of skill in terms of risk assessment. And in Canada, what you're generally looking for is somebody who has a CCPE or an AE designation. That is a Canadian Certified Professional Ergonomist or an Associate Ergonomist. That is the sort of national certification process for ergonomists in Canada, recognized internationally by the International Ergonomics Association. Now, a couple of other things just to make you aware of in terms of resources is if you go to the MSD prevention website, there is a thing called a tool picker. You can put it into the little search box to find it, because there's a lot on the website. It's not always easy to find things, so the search menu works really well. But what it does is it pulls up this menu for you where you can click what you're looking for. So are you looking for some help with an office workstation assessment? Are you looking to assess arm work? Do you just want a screening tool? Do you want something that's more in depth? And you kind of click all of these boxes, and it will actually spit you out some ergonomic tools and checklists and things that you can then roll out and use in your environment. So that's a really great resource to be aware of. So the next thing that we need to do is look at how we develop and select solutions for those risks that we've identified. So that's the next step in our process. So the question is, how do you select your controls and how do you prioritize what is going to get done first? So generally speaking, we tend to look at the hierarchy of controls. Obviously, things like engineering solutions that eliminate the risk are better choices than administrative solutions that maybe just dilute the risk over more people through job rotation or work policy kind of instructions and work techniques and things like that. So that's generally where we want to start. However, given again limited resources, there are times where training methods and lifting training and job rotation may need to be put in place now, because there may not be funding in place for those engineering solutions maybe for another 6 months or so. And so you may need to put a short-term solution in place now, something that is low cost, something we refer to as kind of the low-hanging fruit, until you can implement those kind of higher level engineering solutions down the road. The other thing that you need to keep in mind is when you're picking your solution, what is the effect of that change that you're making, both upstream and downstream? How easy is it going to be to maintain long term? Can you trial these things if you need to? And I guess the one other thing that I would comment on with respect to maybe administrative controls is sometimes where things are really heavy, we have historically had a reliance on implementing two-person lifting policies. And you just need to make sure that you keep in mind the potential implication of a 2-person lifting policy if you are trying to maintain 6-foot social distancing at work. So it can still be done. And obviously, if a lift is too heavy to be done safely by 1 person, 2 people is a better choice. But if there are any ways to sort of manage engineering controls and lift assists, then that is obviously a better choice given the sort of preference to keep people 6 feet apart if we can. And as we start to roll out these solutions, obviously we are hoping to have some kind of system in place where we can assign action items to different people, where we can set timelines, where we can track those solutions. So, you know, again, given the current climate, I've got a lot of facilities where some of these solution implementation projects are being pushed out. And so we just need to make sure that we are keeping track of those timelines. And as we push things out, we don't accidentally lose them or forget them, that they continue kind of to be tracked in a regular way. Now, if you are running into some challenges with coming up with good solutions, I wanted to point you to a spot on the MSD Prevention website called Stories, where people are actually being asked to submit case studies for industries you've done work in, where you've had good solutions. And so you can actually sort by industry. You can sort kind of in different ways to find solutions that other companies may have implemented, and maybe you can borrow and steal ideas from some other industries. So just another place to look for some ideas. So what I want to look at next in the program is, so we've now kind of come up with how we pick a solution. The next is, how do we successfully roll solutions out? Because this is a spot where oftentimes things can go a little bit awry if we're not cautious. So if we're looking at the keys to success for rolling out control, that rollout needs to be timely. So sometimes employees think they've been forgotten because of the time that it sometimes takes to roll out a project. And it's okay for a project to take a long time, but then you need to make sure that employees are aware that it's just been delayed and that it is still in the works, and not that they've been forgotten, because you want to make sure that we maintain their buy-in and their participation in the program. So, you know, it goes a long way to just sort of walk out to, you know, if you're in an industrial setting, walk out to those employees and say, listen, you know, this has been delayed. We've still got our eye on the ball. I'm still tracking this project. But, you know, now we're expecting this isn't going to get rolled out until, you know, early December, or whatever the case may be. We want to make sure that employees are heavily involved in the process. Obviously, employees that have participated both in the selection of the solution and then the training, the rollout of that solution, are much more likely to buy in and use it and then promote that with other employees. Sometimes as soon as we get a solution out on the plant floor, we assume we're done. And it's really important that we know that employees have been trained to use a control, and that employees have been trained to use it across all shifts. So oftentimes in an industrial setting, you know, we manage day shift and afternoon shift very well, but maybe some of this information about, you know, we're instituting a 2-person lifting policy, or we now have this hoist, and this hoist is always going to be used to handle these things. Or we're providing people with chairs, and this is how the levers work on this chair. We need to make sure that that gets rolled out to people. We do no benefit to ourselves to spend money on a solution and then not ensure that people know exactly what they are supposed to do with it. If you think about a standard office chair that has 5 or 6 levers on it, you know, most people are very comfortable with 2 or 3 of them, but have no idea what the last few levers do. And often they are the key to making sure that a chair is really comfortable and set up properly for people. And so we shouldn't assume that this is going to be obvious to everyone, and we need to provide that information to people. And there are always, with these solutions, kind of continued monitoring and tweaks that are required in order to get things right. You know, as kind of an example here, I have a facility where, you know, we went through probably half a dozen trials of anti-vibration gloves in an industry that was doing a lot of heavy riveting before we found one that people were really happy with. And you can see in kind of this other picture, you know, we swapped out these stools with, you know, what is a much better designed seating system here. But if you look at it really closely, you can see the man in the bottom right-hand corner, there was a garbage bag over that stool that he is sitting on. And that's because it was a demo unit and we weren't allowed to get any paint on it if potentially we were going to return it. Now we did end up keeping it, so it wasn't an issue. But this is really about how we involve employees in this process so that they have a vested interest in using these controls when they get out there. Now, we've spoken about training and education kind of through a lot of these different points. So this is sort of to revisit that kind of importance for training and education in sort of a broader picture. So, when we look at training, training needs to be provided, to all of our employees, and they all need different types of training. And the training can be rolled out by any number of different people depending on their knowledge base and, what they can roll out most efficiently. So if we think about, an employee, they all need some kind of basic ergonomics awareness training. They need to know what their role is in the ergonomics program. They need to know what their responsibilities are. They need to understand what ergonomics hazards are, what are the things they're looking for in their workstation to be aware of, and how to report hazards, how to report injuries, how to request assessments if they're having difficulties, and so on. And so that can kind of be done generically to sort of larger groups. Usually the preference is obviously to do these things in person, but I am currently rolling out an employee ergonomics awareness session. It's like a 30-minute session. We're doing it pre-recorded as a webinar because we can't get all of our employees in the same room, and so people will kind of do it at their own pace. And then there is more specific training that has to happen to different employees depending on their jobs and what they're exposed to. So if employees, are doing a lot of work with cranes, then obviously they need training specific to the use of cranes or hoists or things like that. If we have employees who are now solely at home, then they need training specifically with how do you set up a home office and how do you do these things with your empty Amazon boxes and whatever you happen to have lying around the house. So that sort of training then becomes more specific to the role that people are working in. And so it may include kind of best practices for lifting. It might include best practices for, people who handle a lot of carts. How do you, what is the process and the procedure for tagging a cart if the wheels are not rolling properly, so those things, are taken out of circulation and are replaced. And we do know from our clients that the Ministry of Labor has been known to ask for training records, not just who attended them, but they want to see the slides and they want to know what was in the training to ensure these sorts of topics, the roles and responsibilities, the hazard identification is part of that training. Now, if you're looking for some resources for training, obviously the health and safety associations are pretty good with that, but the Canadian Centre for Occupational Health and Safety, has a lot of fact sheets. They have an app now and you can kind of pick a topic and it's got like one-page fact sheets, toolbox talk kind of sized things on both health and safety and ergonomics topics. So what I've got here is, one that's just from the Department of Labor on kind of pushing and pulling. So there's lots of that kind of stuff out there that you can pull from. Obviously, I would encourage you to take a look at our website if you're looking for training resources. We have lots of things available, and as part of COVID, we have been busy recording a lot of the training that we run kind of as webinars that people can now do on their own. Kind of at whatever time is most convenient. So we've got a 45-minute, home office webinar. We now have an office ergonomics training course that's a 4-part series, four times 1 hour. We have a more industrial focused ergonomics assessments course that is also 4 times 1 hour series, and all of our workshops are now being run virtually as well. So by all means, if there's something you're interested in or you're looking kind of to know what's out there, please feel free to reach out to me. Okay, so moving on, once we've got that control implemented, people have been trained on how to use those controls, then we want to make sure that we've done what we thought we had done. And that's really about evaluating a control after it's in place. So the first question is really about when you evaluate those things. So it makes a difference whether you evaluate a control the day it gets implemented, a week later, or a month later. Sometimes the very first instinct is like, this is different from what I usually do. I prefer the way I used to do things, and so I'm not really interested in this new solution, and the feedback you get is not super positive. If there's a learning curve with some kind of new equipment or tooling, that can take a little bit of time to settle out. And so we would obviously encourage people to gather feedback from employees, both right at the beginning, because if there's a problem, you want to know about it as soon as possible, but also kind of further down the road so that we can evaluate kind of how things are once they settle in. If you did an assessment or hazard screening at the beginning, then ideally we redo that same tool in order to ensure that our solution has in fact fixed the problem that we initially identified. And if it impacts other jobs, then we need to go back and kind of screen or assess those other jobs just to make sure we haven't created any other issues anywhere else. One of the things I've got kind of up on the screen here is a 1-minute employee feedback survey that you can do with employees, basically saying like, you've got this new thing, how do you like this new thing? You know, it should take a minute to fill out. It is from the MSD prevention toolbox. And so that's kind of an easy way to do that. You can print them and kind of leave them out at a workstation and ask people to fill it out. Now, the last 2 points are kind of more of a reflection and sort of auditing steps. So step 9 is with each implementation, with each new solution that we roll out, to make sure that we take the time to kind of think about how that went and how we might be able to do that better next time. So, you know, were there gaps or barriers to people participating in a home office webinar that we rolled out? Were there issues with the implementation of a new lift assist? Are we not getting kind of the uptake with employees that we thought we were going to get? What is it that we could do better next time so that our ergonomics program is continually improving with each new rollout, and as we have new people perhaps becoming involved in the program as we move forward? And then the last is really more of a, rather than sort of an auditing of a particular implementation, it's really an auditing of the program as a whole. So the recommendation really is that auditing should be done about every year. It should be done by somebody who's knowledgeable in ergonomics alongside somebody in senior management. So it can either be done in-house or it can be done with the assistance of somebody outside if you're looking for sort of the more objective view. It should include feedback that's gathered from all levels of stakeholders. So that means we're gathering feedback from managers about how the ergonomics program is going, what, you know, how do they see people participating in the program, what are the barriers that they see, the supervisors, the employees themselves, so that we get that from everyone. We should be reviewing, you know, what our annual targets were, what kind of training needs we maybe have moving forward based on some of the results from an audit, and that we create some kind of report out on what are the areas for improvement on our ergonomics program. You know, the timing of this webinar today is great. We're sort of just into November. This is the time where we should be starting to think about, you know, what is it that we want our ergonomics program to do in 2021. If we don't create goals for a program for a year, then we tend to just sort of spend the year, you know, being much more reactive and just kind of putting out fires as they arise, rather than trying to kind of move a program forward. If you've got an ergonomics team or a joint health and safety team and your team is getting stagnant, you know, it's a good time to think about, are there ways to, you know, change up members on your team? Do you need to add somebody from engineering or maintenance or something in order to get, again, that participation from different departments and different groups in order to allow the program to be more successful? And now is also that really good time to look at updating policies and procedures. So I would encourage you to think about how your policies and procedures address the working from home. You know, we've all sort of, you know, back in March thought people were returning to work in September. I hear places talking about their employees going back in January, but it's hard to say whether people will in fact return in January. And so we can't continue to treat the current situation as simply being temporary and that we're going to leave employees who are at home making do for, goodness knows how long. You leave someone to make do for close to a year, and that musculoskeletal damage may have been done at that point in time. So we need to make sure we're putting those things in place, and that you've got some kind of, especially if you work for a large company, that you've got some kind of formalized process and procedure in place for how you are handling the home office situation. If you're looking for an audit for an ergonomics program, there is one that is part of the MSD prevention program. I will have these slides available for you, and I guess the one thing that I would say is you'll see on some of these slides, it says MSD prevention toolbox. These are actually screen captures from the original paper version of the MSD prevention program. My understanding is that they are continuing to move all of those original documents into an online version, but there are still some paper documents that have not made it onto the online version and are still part of only the original kind of physical paper toolbox. And so if you do not have a very old copy of that and you're looking for it, you can also find it in the resource section of our website. So if you are looking for an audit, I'm not sure if this one actually is up on their website yet. Last time I looked, it wasn't. You can pull it from there. So this one has an audit, and the audit is broken up almost into these same 10 steps. So you kind of audit, do you have each of the pieces of this program in place, and where is that kind of room for improvement for your planning for next year? So you should be auditing your training. So are employees being trained regularly? Are we covering all of the required topics? Or you should be auditing, what is the level of risk in your facility? Are you making changes in order to minimize and mitigate risk for your employees? How is solution implementation going? The things you have rolled out, have you gone back and assessed them? Have they been successful? What is the feedback from employees? There is an audit component for your policies and your procedures. And if you are a facility that gathers a lot of data, then you should be gathering the data on, your injury rates and your compensation costs and the cost of your ergonomics program and the cost of solutions, because what we know is if you track all of these things, you can really start to see that return on investment for your ergonomics program. So if you're able to track things like productivity and quality and all those things that ergonomics can have an impact on outside of just injury prevention, then you can really start to demonstrate that return on investment. So as part of the webinar today, Samantha is going to be sending out a newsletter, and that newsletter has a whole article about tracking your return on investments. And it has some really interesting statistics about those other improvements and how large some of them have been in some research that's been done in terms of tracking things kind of above and beyond just injury prevention in order to help kind of sell the benefits of an ergonomics program and to allow us to sort of raise the awareness of, the impact beyond just injury prevention, because there's so much more good that kind of comes from these things. All right, so I am going to take a minute to answer a few questions. So if people have things they want to start typing in, I'm going to talk for one more minute, and then I'll take a couple of questions. If you are interested, I would encourage you to take a look at our website. If you go to our website and join our newsletter before the end of the week this week, we are going to do a draw for a complimentary viewing of our home office webinar. So anyone who joins the mailing list this week will be entered into that draw. If you're already part of our mailing list, but you still want to be entered in the draw, send us an email and just kind of indicate that you're applying the OHS draw in kind of the subject line, and we'll add your name to the draw as well. And then I'll send out an email to the person that wins the draw to give them access to our home office webinar. On that note, are there questions that I can answer then?
Thanks, Rachel. So, first question is, in this time of COVID, many employees work from home. How do we assess the ergonomicity of our employees set up at home? privacy issues? What is our responsibility for MSD developed working at home?
Yeah, so I think we still have a responsibility to make sure that those folks are taken care of at home. I would say the best way to do that is to provide your employees with education to do it properly, to set themselves up, and you can send them resources to even do kind of a self-assessment checklist, and then making assessments available to people who need it. So I don't think we need to assess each person's home office workstation, but we should have a way for people to request an assessment of their home office workstation. And usually those are done via WebEx or some kind of video chat, and then you have people send in kind of some pictures of their home office. So it would be voluntary on the employee's perspective, but I think the employer's responsibility is to ensure that you've provided them with the education and some kind of access to basic equipment.
Okay. Second question is, what do you recommend is a fair time frame for recertification? Annually or every couple of years?
I assume that we're talking about recertification of like ergonomics awareness training, like some sort of basic ergonomics awareness training. And I would say that that probably should be done every year, even if what it looks like is something that's a little bit longer every couple of years, and then something that's like slightly shorter in between. The other thing that some places will do is they do kind of their larger training every couple of years, and then they'll have a couple of like ergonomics kind of toolbox talks or something like that in the years in between, like 2 months of the year, there'll be a 15-minute ergo toolbox talk. So it sort of keeps things front and foremost of people's minds, but you're not doing a longer training session kind of on a regular basis. But I would say best practice is you do half an hour, and you do it once a year.
Brilliant, thank you. Okay, third question is, where I work, the employer favors productivity over safety. How do you go about introducing ergonomics that may stag productivity?
Okay, so that is not easy to do, and that happens, and especially now where companies feel like the bottom line is tight, is an uphill battle. So the best thing to do, I would suggest you take a look at the newsletter that we're going to send out that's got some stuff on return on investment that shows some really good statistics on how productivity suffers when ergonomics is poor. And if you can pull any existing data in your facility to show how much poor ergonomics is costing, then you may be able to speak the language of the upper execs who are putting productivity front and foremost, to show them that doing good ergonomics is not just about like, I don't want my back to hurt. It is really about the bottom line for their company. So you need to speak the language that they are focused on in order to sell that to them. But until you get them on board, it's an uphill battle.
Brilliant, thank you. So that seems to be all the questions that have come in thus far.
If anyone has additional questions or I did not answer what you were actually asking, feel free to send me an email, and I'll try to point you in the right direction or at some additional resources if you need them.
Brilliant. So I'm just going to take a moment to tell everyone about the webinars that we do have coming up. So I'm just going to switch the screen back to mine. And you'll have to excuse the PowerPoint presentation. I'm only using one screen now, so it's a little difficult to jiggle. So we do have, I just wanted to shout out the next webinar that we do have coming up. It's going to be about the new Bill C-65, the Federal Harassment and Violations Regulations. And so that's coming up on November 25th. And then on December the 2nd, we've got Managing Challenging Employees During the Pandemic. So those are going to be the last two of the year, unless anything last minute comes up, and we'll try and get that out to you. But really, I just want to thank Rachel once again. Fantastic webinar, really insightful. I am personally someone who works from home all the time, not just because of COVID. So I always find these very enlightening. But yes, so just a reminder, I will be sending out the slides and all the information that Rachel mentioned, the newsletter and the slides and the video will be coming to you via email. Please do give me until about lunchtime today to get those out to you. All these upcoming webinars that I'm talking about will be coming in your inbox, or they are on our site. If you are a member, you can access them. And anyone who's not a member, if you would like to have a free trial, you can do that on the site, or when our representatives call you today to check on everything that went today and to see if you got all the material, you can do that then. And I just wanted to also make a comment. If anyone has any recommendations or requests for webinars, please do send me a note. My email, you can get me on webinars@bongod.com. I do my best to cater to your needs. And so if you have something in particular that you'd like, you can just ask me and I will try and make it happen. But thank you, Rachel, once again. Thank you, everyone, for actually attending these webinars. If it's not for you, we wouldn't really do them. And if you have any feedback, do send it back to me. Thank you, everyone. Have a great day.
Thank you.
Thanks, Rachel.